Hi, everybody. This is Dr. Mary Gardner with Lap of Love Veterinary Hospice, and I have a very awesome Facebook Live planned for today with our guest speaker, Dr. Sheila Robertson. So just to give you a little background on Sheila, about 15 years ago when I was in vet school, I walked into a lecture for anesthesiology, and I thought, oh gosh, this is going to be horrible. And there was Dr. Sheila, and she just blew my mind with awesomeness and also presented the material in a way that I could really understand it and comprehend it, because it's a little bit, hard. I'm not going to lie, Sheila. And ever since then, she's been somebody that I respect, honor, and just have learned so much from. And about 4 years ago, I thought, oh, Sheila, you would be really awesome here at Lap of Love to help our doctors with pain management, sedation, and some other tips and tricks. But Dr. Sheila is board certified. I'm going to throw something up on the screen here. It's got like your list of stuff. So Dr. Sheila not only was at the University of Florida teaching anesthesiology and in clinics and in the lecture halls, but also in Michigan, right? And you've got these ton of letters after your name. So can you explain what this is?
Yeah. So it means that I've liked learning new things my entire life. That's what it really means. So the BVMS is like a DVM, but yep. It just shows that I graduated from the University of Glasgow in Scotland, and I did a PhD in anesthesia at the University of Bristol, and then I'm a diplomate of anesthesia and analgesia in the US, but also in Europe, and then I'm board certified in animal welfare in America and also in Europe, and I am trained in acupuncture as well. That's kind of what that all means.
That's all what it means. Okay, so a lot of people don't realize that, like I'm a veterinarian, a regular general practice veterinarian, but you can go on and get additional training and get board certified and things. And that's the big one for you is anesthesia. Well, not the big one, because welfare is just as important, but anesthesia. And so just like in human medicine where you'll have an anesthesiologist, we also have that in veterinary medicine. So dare I say you are uber qualified for this Facebook Live discussion. And good, check. So I got the best person to talk to us today on what I think is such a great topic, and that is my pet too old for anesthesia? And I think a lot of people, once their pet hits a certain age, maybe just double digits, I think we're always nervous about anesthesia, right? Even for us humans to do anything, we're nervous about it. And our pets were nervous, especially as they get older. So I wanted to touch on this topic because, are there things that we should be looking for? Are there things that we should be asking our veterinarian? What can veterinarians do to make sure that our pets are safe? And I want to give a shout out to some special Facebook groups out there. So I know we've got Lap of Love fans and friends, but I posted this on the laryngeal paralysis Facebook group that I'm a part of. I posted this on the cognitive canine dysfunction group, which I love those guys in there, and also the Cushing's group, which is just because I have all these animals too. And so often when I'm on those Facebook groups, I see the question, like, especially in the laryngeal paralysis group, like they're nervous to do the surgery because their pets are older, especially in these diseases that are older, diseases typically, right? So, and I'm also checking out some comments along the way. So Sheila, what are your thoughts on, and I know there's sizes of dogs and cats and stuff like that. What could you tell us about just in general, fear of anesthesia? Like, the myths and misconceptions.
Yeah. So the thing is, I mean, the other thing that makes me able to talk very openly about this topic is that I've been an anesthesiologist for, dare I say it, 40 years now. 40. Yep. So, yep, I graduated when I was 21, and I've literally been doing anesthesia since my PhD the year after I graduated. So, yeah. So, seen a lot of things. I've learned from my mistakes. So my job now is to teach people not to make those mistakes. But I think what we've learned is that, age is people say age is not a disease. And I would agree with that, but it comes with some things that are unavoidable. So there's the obvious things that you see, that, the eye changes, the skin, the nose. But what I'm thinking about as an anesthesiologist is what's changing under the surface, the things we don't see. So the main thing about aging is that you just don't have as much backup or reserve, like troops to call in, like if something's going a little bit wrong, like you're losing blood under anesthesia or your blood pressure's dropping. There just isn't that reserve to call on. But anesthesiologists know that, and then we should shout out and say that now in the veterinary profession, veterinary nurses and technicians can specialize in anesthesia. And it's a very, very, very rigorous process to go through. So you can look and see if your veterinarian has a licensed nurse or technician that has gone through that specific anesthesia training. And those guys and girls are amazing. I mean, just amazing.
Right. I remember them at vet school. I felt like an idiot.
Yeah, they're wonderful. And you can look up on the acvaa.org website where anesthesiologists are available for consults, where they work. A lot of them are in private practice now. You can ask a question, has your team been trained specifically in anesthesia? So there's things we need to think about. And I think one of the biggest things is that some of the older pets are fragile. And so that has nothing really to do with the anesthesia part. It's how that we remember to place them on nice, soft operating tables and, keep them comfortable. A lot of them have arthritis. So think about how you position them, use soft padding. And then anxiety is a huge issue. And it used to be that we had to deal with all the ramped up, dogs and cats once they got to the clinic. And once they're all wound up, calming them down, they're just like in a frenzy. But now we can deal with that before they even leave their own home. So your veterinarian can prescribe a sedative to be given at home for dogs and cats. So they're chilled out for the journey. They arrive like, hey, I'm on. Huge, huge difference. So they're not anxious. Their heart rate's not high. They're not got all this adrenaline running around their body. It's easy for us to work with them. And then that right there makes anesthesia go so much smoother. And they actually require less anesthetic, which is always good if they arrive kind of chilled out.
No, that's a good point. And I know for my own dog, like I get nervous. I need a little sedation probably beforehand going in. Now, what do you think about like blood work and things to look at before anesthesia, which is so important, right? Especially at any time, but even for them aging. But if a dog or cat does have some kidney insufficiency, is that a reason maybe not to do anesthesia, or what could we do as doctors to help that?
Yeah. So, blood work is always a really, really good idea, and our elderly pets should be having their sort of twice a year or once a year blood work. And usually they, unless it's just, be done recently, they'll ask to do another very specific anesthesia screening. And that's looking at the kidney, how the kidneys are working and how the liver, because basically every drug that I'm going to give to do the anesthesia and control pain is going to depend on the kidneys and the liver to be, metabolized and then out of the body. So we look at that, but I have to admit, when you do a good physical exam, none of the blood work is usually a big surprise. Yeah. And then when we get the blood work, we look at it and we go, okay, so we have so many drugs to choose from. We go, okay, so this looks like we have a little bit of deficiency in how their kidneys are working. So we're not going to use this drug. We're going to avoid a very specific antibiotic. We're going to say, because we have to remember that the whole picture, some of the other drugs aren't really anesthesia drugs, could interfere with what happens. So I might say, let's make sure for this dental, we avoid this drug, but we don't use that antibiotic either. We'll choose an alternative. And then, you know, we might say, well, why don't we have the dog come in a little bit earlier in the day, you know, very early in the morning, and we'll place a catheter and we'll get it on some fluids to get you very well hydrated. And the other thing is now we, you know, don't have owners take away the food and the water the night before. They have access to that, all the things that we've learned. So then if I see the dog's got, a lot of people listening will know, like, their vets told them that their dog has elevated liver enzymes. Well, that's very common, but it doesn't mean that the liver's not working. It just means it's been stimulated by something, and usually it's the drugs that they're on. So if they're an epileptic or they're on drugs for their arthritis, and we look at the numbers, but it doesn't predict how the liver will work. And then there's another number I look at, which is called albumin or protein. If that's low, I go, yeah, we should be a little careful. And then we just choose our protocol. And the toolbox is huge nowadays that we have to choose from. It's a big toolbox of drugs.
And that's so important for people to realize that, yes, and there are some diseases that might elevate liver enzymes, like Cushing's, and there's a lot of people on here with Cushing's dogs. And if your dog has Cushing's but needs to have a dental cleaning because their teeth are horrific, which could then cause, you know, a lot worse problems than we even realize, or maybe there's a mass we need to have removed or what have you, they might be nervous, but we could choose other drugs that are more sparing, I guess, of the liver, that you could say, or maybe it's not even that much of a concern. It's a little elevated, but it's nothing that we would be too concerned with. Okay, so now what about like heart problems? So a lot of older dogs have some heart problems, and you know, we might be nervous about doing, let's just say, a dental cleaning. And a lot of times these are smaller dogs with horrible teeth, and they might have a murmur, or, you know, some other issues. What are your precautions there, or concerns?
So the major thing has changed since once we realized that we could actually have these animals arrive calm and not get ramped up in the clinic. So the thing that hurts dogs or cats with heart disease worst is if their heart rate goes up very high. Like you, we get scared and are like, whoa, we're going thump, 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 thump. That just means that that heart is working so hard, using up oxygen and not working. So the pre-sedation at home, and then everybody is learning, you know, cat-friendly, fear-free, low-stress handling. So keeping the heart rate under control is the main goal. And then there's a couple of drugs that will make the heart rate go up. So we just say, not for this animal, but we have other ones. And then so many of our drugs now, they're reversible. We give them, and then there's an antidote that we give at the end, right? So it's on, off. And, you know, we have to look at what type of heart disease they have. And then the other thing that we've learned over the years is, in the past, a lot of those dogs and cats got in trouble because people gave them too high a volume of intravenous fluids under the anesthesia that they didn't really need. So the heart has trouble working with that extra volume. So now we change our fluid rate that they get, their IV rate gets changed because of their heart disease. And then the other thing is the monitoring. So we have, so many nice monitors now. We measure their blood pressure. We measure if they've got enough oxygen in their blood. We're looking at their heart rates. And the other big thing is keeping them warm, to keep everything just right for the heart to work correctly, not letting them get.
So let's talk about temperature for a little bit, because we know we love our hypothermia discussions. So what happens in general with pets that are older, even without surgery, like with their ability to regulate their temperature?
Yeah, so as we age, and it's people as well, it happens in animals. So we have a thermostat, like right in the center of our brain, that allows us to control our body temperature in a very tight range, 24 hours a day. And that's important so that everything, works correctly. And under anesthesia, that thermostat, instead of being like this, it kind of like has a bigger, margin of like moving one way or the other. But in older animals, it's not a well-controlled thermostat. It's got, a wide range. And so what we have learned is that when they're older, their thermostat's not so tightly controlled. It's like having a really old-fashioned, not a digital, it's like an old-fashioned thermostat. And then the other thing is they would normally respond by, like closing down the vessels to their skin. They can't do that as well because that would preserve heat. And then the other thing is a lot of heat in the body is generated from muscle. And then talking about old animals, and you've probably talked about it, the sarcopenia, the muscle loss. So they don't have the heat generator, and then the metabolic rate is lower. So they're not making as much heat. So from the minute they come into the clinic, that's when they could, if you've got your AC jacked up and you put them in a cold waiting area, that's not good. So we put them in little microclimate, heated kennels, put a blanket around them, give them a jacket, right? And then after we sedate them, we're monitoring them, and we have all sorts of devices that we can use to keep them warm during anesthesia. And when they come out of anesthesia, if they haven't lost much heat, they wake up very, very quickly. So getting cold is the main thing that causes them to have a long wake up time.
Mm.
So we just have to be very aggressive. Literally, the minute they come in, they need to go to a warm, nice, cozy place. Like cats, you can give them a cat cave, right, to hide in and keep nice and warm. So we're just very, very aggressive, I guess, about making sure that we're checking their temperature and keeping them warm.
Right. Okay. So let me ask you a few questions about statistics, if you know, because I know if anybody knows statistics, it is you. And we're always so worried about anesthesia, right? So, but what really is the risk?
Yeah.
In general, and maybe even in older, and where is the biggest risk? So what's the risk?
So unlike human anesthesia, there's no obligation for veterinarians to ever report an anesthetic death, right?
Okay.
But there have been some studies done where people have voluntarily agreed to be in a study. Now, the biggest one we ever did, or the veterinary community ever did, was published in 2007. So it's quite a while ago. And in that study, they looked at 98,000 dogs and 80,000 cats. So it was a good study. And in that study for cats, they showed that cats over the age of 12 have probably about twice as likely to have an accident, a bad event, like something goes wrong, like a close miss, or they do actually have an anesthetic death, compared to cats in their prime, between 1 and 5 years of age. And that data was like, it changed how we did anesthesia, that study, because we can say that true, back in 2007, and the study was actually done in 2004, but took 3 years to get published. At that time, cats over 12 were twice as likely to have a problem. Something happened that wasn't great under anesthesia. But now we've learned from that study, and a lot of it was the drugs, they could actually identify the drugs that put them at risk. So we go like, okay, we don't use those drugs. The people weren't weighing the cats accurately, they found out. So you could accidentally overdose the cat. People putting the tube in that they use, for breathing during anesthesia wasn't being done with, as much expertise as it should be done. And then keeping them warm was a huge issue. And they weren't giving the right amount of fluid. So we've learned all of that. So we've fixed all of that. So I think if that study was done again, the risk for older cats would drop again. And it's not just about their age. I mean, I've done some 2-year-old cats that are really, really sick. And then I've had a 20-year-old cat that had normal blood work. So it's the individual animal. But
Correct.
That study, that it told us what the problem was. And the problem also is that most of them have problems when everything's over, when they're in the first 3 hours in the recovery room. So we changed our practice completely, that every animal has someone looking after it, watching it in that critical time period, in, you know, keeping them warm, making sure they're not got their neck kinked, that everything is just, so you don't leave them alone in that 3 hours after they wake up. They're under observation all the time. And that's when most of the problems actually happened.
Okay. And now, do you say it's similar with dogs? What was the evidence in the dogs? Or
the dogs, currently we cannot say what the risk is based on age, because every study that has been done so far has just used, you know, actual chronological age, like they're 12. So dogs over the age of 12 had a higher risk, but they didn't look at whether those were 5 kilo, you know, 10-pound dogs or 200-pound dogs. And we all know that the smaller you are, if you're a dog, the longer you live, right? And the bigger you are, the shorter your lifespan is, unfortunately. So nobody's done the data and sorted it out on life expectancy. So someone needs, to, you know, because me, you know, an 8-year-old Chihuahua is not old, but an 8 English Mastiff, that's gone, right? So no one's done the right study, but again, we know, you look at the blood work, and with dogs as well, the time they get in trouble is after the procedure.
After.
Yeah.
So still for both of them, it's really after the anesthesia, the surgery's done, it's that monitoring and making sure that they're warm, watched out, you know, airway is good and things like that. Yep. So now let me ask you, is it just in general, what's the risk of anesthesia? Is it 5% mortality, like that they're going to die, 5%?
No. So even back in 2007, for dogs, it's like 0.12%, and for cats, like 0.24%, something like very close to those numbers.
But so 0.25%.
Yeah, but now there's data coming out of, like, you know, spay and neuter clinics, and they don't all just do puppies and kittens, that the mortality rate since 2007, so a huge study that was done with thousands of dogs and cats undergoing spays and neuters and other shelter procedures that weren't all puppies and kittens, the mortality rate was getting very close to what it is in humans, which is like 0.03%, that we're achieving that. You know, if you know, they go in, we kind of know what's wrong. And the thing is, that study was done with people that know what they're doing, like they know how to do those surgeries, and they keep the time under anesthesia short. So that is a key factor, is that you're organized, you plan, and you do everything, you know, exactly how you need to do it, but you don't waste time doing it.
Right.
So
no, that's so true.
You have a team lined up. Yeah, I was once told by my anesthesia mentor that if you're me as an anesthesiologist, if I'm sitting there or standing there looking at an animal under anesthesia and something's not happening to it, we didn't plan right.
Mm.
Right?
Right. We're wasting time.
We're wasting time.
We're wasting time. Okay. So just to kind of just recap on the percentages, it's really about as safe as human anesthesia.
Is we're getting close.
We're getting really close. So that's like, you know, and I know there are people that are even listening that have lost a pet because, you know, of having something done, and it may not be because of the surgery. It may also be because of the disease they have, or what, you know, what we were treating, or something like that. But the risk is still very low. And sometimes the risk of not doing the surgery is higher than the surgery, if that made any sense.
Well, for the biggest one that we hear is, don't you think he or she is too old, considering it's just to do a dental, and this just to do a dental. So we have data to show that if you keep your cat's teeth cleaned and nice without all the tartar and the buildup, you can actually delay or even avoid chronic kidney disease.
Oh.
A lot of the inflammation in the cat's mouth, we think, stimulates other inflammatory problems that cats have. So actually taking the, you know, time out to do the dental when they need it, when you're advised to do it, but will actually prevent worse things happening. Then the other thing, because I know we have some LARPAR or the GALP group are on, we radically, I worked with Dr. Bryden Stanley, and most of the gulp and lower power people listening in know who that is. She's a phenomenal surgeon that was at Michigan State with me. And she actually discovered that that disease doesn't just affect the throat, the larynx, it progresses and so on. And we used to think, oh, you know, this is a big, you know, surgery and they have all these risks that they might aspirate and get pneumonia and so on. The actual surgery is minor surgery. The incision, it's like this big. It's like an inch right here on the left side of the neck. It's an inch. It's not like having
abdominal.
It's not like having a spay. It's not like having cancer mass taken off. Nothing like that. And the one thing that we realized is that if we actually stopped giving narcotics to those dogs, like the opioid drugs, because they often make them kind of feel bleh, and they want to vomit. So we give them antiemetics, and the one a lot of people listening in will know about is Serenia. And anyone that's ever had surgery themselves probably knows that they've had ondansetron, which is like, you know, amazing drug. And then what we found was that we just put a little bit of local anesthetic like you get at the dentist into that 1-inch incision and then put an ice pack on it. And we never, our problems went like just disappeared with that surgery.
Wow.
Like, you know, for the actual surgical time that they were with us, they would pop right up. They weren't like sleepy. They were, you know, obviously how you let them drink and eat changes. But yeah, we just suddenly realized this is such a minor procedure and it's not a painful procedure. And, you know, just maybe a little bit of one little opioid that we use that never causes vomiting and an ice pack is about what those dogs need to be feeling great.
Yeah. And as many people may know, I had my own Doberman, pictured there, had a tieback. And it was, you know, I was nervous just because we all are parents, right? We're still going to be nervous. Now, 2 things I know I need to ask you. One is I've heard a lot of people say, and somebody even posted here in a comment, you know, I think my dog or cat, their personality has changed afterwards, or even that they took like an excessive amount of time to get back to normal, like over a week. But there's concerns that they feel like they've changed and not for the better, because sometimes they see for the better, but not for the better. Any thoughts on that?
Yeah, so that is a huge concern in elderly people who undergo anesthesia. And actually here where I'm living in Gainesville, Florida, there's a huge group of anesthesiologists working on this, what they call cognitive decline associated with anesthesia. So elderly people, they give them a puzzle or something to do before anesthesia and then after anesthesia. And usually there is a drop in cognitive function after anesthetic. And it can be temporary or it can be sometimes permanent. And they're beginning to isolate like what it is. And one of the things is, you know, like choosing the right anesthetic, and they're figuring out what that is. And then they're figuring out, can we do it under a lighter plane of anesthesia and avoid and use some local anesthetics, like more like doing it like a dentist would do your mouth. And then the other thing is cognitively challenge them afterwards, giving them, you know, like getting their brain working right afterwards. So like puzzles and talking to them. But there is a drug that they think can contribute to it. And it's, you know, they're called benzodiazepines. So that's Valium or diazepam and midazolam, which some of the people listening in would know said. But those drugs can be reversed. And a lot of people in the veterinary world don't think about that. So in my older patients, if I feel I have to use one of those drugs because they're anxiolytics, then I would automatically reverse it after anesthesia. And that's something I do. But now that we have them sedated at home by, you know, the RDVM are all like recommending sedation, we can pretty much avoid sometimes even using those drugs that are linked to this cognitive decline in humans. But the other thing is, a lot of people probably know that if they've had anesthesia themselves or they've had an older pet, sleep cycle goes out. I mean, it's crazy, right? And they need to be able to sleep normally to heal. So what we're now recommending, and they're doing it for anxiety and to restore the sleep cycle in people, is to give melatonin for like a week. like the night of, as soon as they're discharged, they take melatonin that night and for several days afterwards, because older animals don't release melatonin in the evening. And if they've had a surgery, you're not as likely to be taking them outside to get stimulated by natural sunlight, which is one of the stimulants. So melatonin is something that is being looked at as a way to reset their sleep, or assist with their sleep cycle, but is an anxiolytic agent as well.
Okay, so this is great, and that's why having that pre-sedation, right? Drugs beforehand that your veterinarian can prescribe, reduces the heart rate, reduces the anxiety, reduces all these things that can be help preventative of problems during and after. Now, I posted this link on one of the Facebook groups, and somebody's like, I'm not worried about anesthesia, I'm worried about intubation. And I said, well, intubation is a part of anesthesia. Like, anesthesia is not just drugs, right? It's a lot. So they're worried about the intubation part of it and being rough or hurting their pet. Any help you can give their nerves?
Yep. So intubation in dogs and cats is a lot easier than it is in humans. But cats particularly are very, very sensitive to having their throat touched. So they'll often go into a spasm. So we learned from that study we talked about with the cats that one of the problems in recovery was that they got a swollen throat and they had trouble breathing. So we've taken cautions to advise people that when you're intubating, that you want to make sure that as soon as you start to intubate, if a dog or a cat starts to react, like cough or do anything, don't intubate. They need to be a little bit deeper so you don't have a response. The other thing is you can put some a little topical drop on the airway to prevent them reacting to the intubation. But that is a very, very important part. And then we do have a new device that's been developed for cats that is called a Vego. It's a laryngeal airway that actually sits over their breathing pipe, but doesn't go into their airway. And they don't have a cough afterward. They don't have a sore throat. And so, a lot of veterinarians are using them for fairly, short procedures. But yes, intubating is very important and should only be done by someone who has a lot of experience. But there's no, a lot of people used to feel like it was, a badge of honor to be able to intubate a moving object. And that's no longer a badge of honor. A badge of honor is to be able to put the tube in with no response by the animal, none whatsoever.
Right.
Yeah. And then we have a new way, or we talk about how we inflate the cuff that causes that's done in a very that used to cause a lot of sore throats because people weren't taking care. So there's a lot of educational things being done to make intubation, because it is identified as a issue because they get swollen, sore throat, they can cough afterwards, and it can be unpleasant. Yeah. So we've done a lot of education around intubating correctly.
Yes, so much has improved. Now, if somebody is needing to have something done, what could they ask their vet, or what type of vet should they be looking for, to make sure that they're doing it properly, that they're skilled at these things, that they're thinking about the temperature and post-anesthesia and the intubation and things like that? What could they ask of their vet?
Yeah, so I think a lot of people ask about the surgery and ask about that, and then they go, oh, but to do that, we need to do anesthesia. And so, yeah, you should ask a lot of questions about who's doing the anesthesia. Well, obviously, the veterinarian decides on the protocol after having looked at the drugs, decides on the drugs and looks at the blood work. But usually in general practice, it is a technician or a nurse that actually does the anesthesia under the supervision of the veterinarian. But those nurses and technicians do it day in, day out, right? They're putting in catheters and monitoring. But you should ask, who does the anesthesia? Are they with the animal all the time? Because a lot of anesthesia is not rocket science, it's paying attention. And basically, an animal under anesthesia should never be left unattended. That would be, someone should be dedicated to looking after that animal all the time, and I would ask that. Then I would ask them, you know, what do you monitor and how do you monitor? Are you monitoring the blood pressure? Do you monitor, you know, oxygen levels? Do you monitor their temperature? You know, all those types of things. Do you give them something to make them not want to feel nauseous or want to vomit? Because, you know, that shouldn't be an additional, that should be like, everyone should get that, right? That should be a part of the package, not an add. So you should ask questions, and actually, I mean, we can maybe post, there's, you know, my cat needs anesthesia. The AAFP have a website and it has a brochure about my cat needs an anesthetic. What do I need to know? And then there's also one from the American College of Veterinary, you know, anesthesiologists have one, and it talks about monitoring standards and so on. And then you can say, I want to go somewhere, and you may find someone in your state that there's a board certified anesthesiologist or a certified technician who runs the anesthesia, and you may decide that's where you want to go. And no one should have a problem with that.
Right. Like, right. Because a lot of general practices don't have like I am not certified, but when I was doing surgery, I was administering anesthesia. I was monitoring. I'd have a technician there, and my technicians were not certified, right? But I would not feel at all upset if somebody came to me and said, I would rather go to a place where there's a certified technician or a boarded veterinary anesthesiologist. Like, if you can, if you have the means, that's okay.
Yeah, the commonest anesthetic referral I got in a referral hospital that I worked in. So it was a high-level referral hospital, and we got a lot of, you know, they said, why has the animal come here? And it was like, because their own veterinarian didn't want to do the anesthesia. They could do the procedure, like a dental. They were happy to do the procedure, but they weren't comfortable with the anesthesia. So we did a lot of old dogs and cats for dental work, and the dental part of it was not complex or difficult. That was more complex was all the different problems that dog or cat had that made the referring veterinarian too worried about the anesthetic to focus on doing the dental. So we got dental as anesthesia referrals, right? That's what they wanted to do. Send it to someone that can do the anesthesia part, and we'd be much happier and less stressed about getting this dog or cat done well. Yeah,
for sure. And I know when I had my tieback done for Duncan, like that, they were certified technicians. It wasn't and I was never worried about that, right? I just knew they were in such good hands, and that's helpful for us.
Yeah, technicians they're like my wingmen and women. They're like your, you know, right hand or left hand, depending, people, and they are, you know. I mean, I teach that when you're doing anesthesia, it doesn't matter who you are, you should treat an animal as if it's your own. Act as if the owner is looking over your shoulder, right? That's if you're doing anesthesia.
For sure. Now, and you know, I just want to bring up something real fast. My own dog, Sam, she has lymphoma, so she's getting chemotherapy every week. And it was interesting. I was talking to Dr. Correa, a little shout out to my oncologist here in South Florida. But she said to me, she's like, we at the oncologist, she's like, we do so many dentals because these older pets are coming there for oncology. And she's like, what's worse is their teeth. And she's like, we can't even fight their cancer because their teeth are so bad, and it's going to give infection. And if they're giving steroids, so like it's this dental is so important. Now, I want to encourage anybody to write any questions that they may have, but something fun, I know, and I've been watching, Sheila, don't you worry. So something fun is the scent from home. And so if you want to bring your animal for anything, for staying, but even for surgery, for recovery, what about, you know where I'm going with this, the owner's scent.
Yeah.
What can you tell us about that?
So that's the other thing is, you know, your veterinarian may say, bring something from home to stay with your dog or your cat while they're here. But you should just say, I'm going to be bringing something from home and I want to stay with them. So it could be their favorite toy. and it'll get a little label put on it so they know it belongs to Duncan or it belongs to Scotty or whoever the animal is. So either their favorite toy that has been marked and got slobber on it, so not something brand new and clean, or what a lot of people do is a T-shirt that you've recently worn, leave that behind. Yeah, I once had a police officer brought their dog in an emergency, and you know how they're tough and strong and everything. It was actually a bloodhound, and they'd been out on a search, and it got injured. And it was away from his handler. The dog was really, really anxious. And, it was an emergency, so we didn't have time to plan. And I said, we need something of yours to leave with the dog. And the guy just pulled off his shirt and gave it to us.
But it's,
yeah. And we were like, great, because he'd been sweating with the dog, and the dog like literally curled up on that thing all the time it was with us. So it is important. And or even if your cat has a special bed, take it there and can my cat just use this while he or she's here? Yeah.
Right.
With them and home.
Because studies show they are happy, basically, right? That when they smell your smell and those familiar smells.
Yep.
I have somebody wrote a comment about their 17-year-old spayed female Samoyed, and if anybody knows, I'm also right there, who's got a lower cracked jaw, tooth, a few pieces showing gum line, doesn't know if he's bothered, but he's been putting it off because of the length of anesthesia. And I would say to definitely see, there's also boarded veterinary dentists. Here in South Florida, there's a wonderful one. So look for a boarded dentist. So that way they could do it faster, more skilled, and they're going to be better at it. Like, I was not the best at removing teeth, and I always knew my limitations when I was there. So, but that they could be causing pain and things like that. So I can understand, but go Samoyed lovers out there.
Yeah. And then the other thing that, a board certified dentist is going to go faster, and their main client population are old dogs and cats, right?
Right.
But the other thing is they may suggest that because of the age and what they're looking at, that they may they may do diagnostics, like just, very short sedation. Let's get the x-rays done, make a decision what needs to be done. That's what we're going to do today. And then the next time it's like straight in, fix it, right?
Right.
So it breaks the procedure into two simple periods. And some people do that. Yeah.
That's a great point, right? Because taking the x-rays, processing them, evaluating them, that takes time. And so if we can break that, that's such a great idea. So hopefully that was helpful. Gosh, there's so many things I can ask you, Sheila, and so many, I know, questions that people want to ask. But I appreciate your time, because it is so hard for me to see when people just don't want to do something because their pet is old. But I want to say, like, yes, things can happen even to the young ones, but the risk is low, especially when in trained and qualified hands, and doing some just asking questions, evaluation. Us veterinarians do not take offense to that, right? These are your babies. So we get it. Absolutely. And, I just want to remind everybody that about all of our quality of life scales that we have on our website, some other information that we have. And, Lap of Love, we will do, as you know, we are in-home end-of-life care, so hospice and euthanasia, but we also offer tele-advice. So for families that are questioning whether it's time, and that's all around the country. So we don't have to just be in an area that we have. And like I said, Sheila actually is a Lap of Love veterinarian. You monitor basically all what we're doing, our sedation protocols, our pain management, and things like that. But you lecture to veterinarians all across the world on anesthesia, especially on our geriatrics. So like I said, I don't think we could have had a better person for this topic.
Thank you.
And I know that, listen, this is probably my longest Facebook Live, but I think such an important topic. And look, we're at like 45 minutes. But I hope this was helpful to so many people out there. And I know that there's going to be even more people watching afterwards. A lot of people couldn't watch this, so I'll make sure that we post it online. And Dr. Sheila, from the bottom of my heart, you know I love you dearly. And you were the anesthesiologist for some of my own pets.
I know. I remember sending you photographs as soon as we got them into the safe zone. Yep. I would have.
Right. I still have that from Neo, who had Cushing. So all my favorite Cushing people out there. My first Doberman had adrenal Cushing, so I had his adrenal moved, and he did great, and under the doctor and your care. So I appreciate that. We have a lot of thank yous coming in, and so we're super grateful for your time. And I'm very thrilled that there were so many people watching. And again, hopefully this have given some people some hopefully some relaxing, right, over the worry, and maybe not to be as scared, because some of these procedures can be very helpful and needed. And so you gave us great tips.
Just make sure and ask your veterinarian write down the questions that worry you on anesthesia, and they should answer those questions and put your mind at ease. Yep.
Exactly. Awesome. All right. Well, thank you again so much, Sheila. I appreciate it. And bye, everybody, for watching. And don't forget to love up on your gray muzzles.
Yep.
Bye.
Bye. Thank you.
Thank you.